If you are between 65 and 75 years old, I need you to stop what you are doing right now and listen to me carefully, because what I am about to share with you could be the most important thing you hear this entire year. I am not saying that to get your attention. I am saying it because I have seen what happens when people do not know this. I am Dr. Daniel Chen, and for many years now, I have worked with older adults, people just like you, managing blood pressure, managing heart disease, managing kidney disease. And in all that time, I have seen a pattern that breaks my heart. Every single week, patients come to see me, good people who take their medications every morning without fail, people who exercise, people who try to eat right, and yet their kidneys are failing, slowly, quietly, without any warning they could feel. And when I sit with them and we go through everything together, almost every single time, I find the same thing. The very medication they were taking to protect their heart was quietly destroying their kidneys at the same time. Now, I want to be clear about something before we go any further. I am not here to scare you. I am here to inform you, because there is a very big difference between fear and knowledge. Fear makes you stop your medication without telling your doctor. Please never do that. Knowledge makes you ask better questions. Knowledge makes you get the right tests. Knowledge keeps you safe, and that is exactly what today is about. So let us start at the beginning. Let us talk about why people between 65 and 75 are at such unique risk. Most people assume their kidneys are fine because nobody has ever told them otherwise. But here is what the research actually shows. Kidney function declines by approximately 1% every single year after the age of 40, 1% per year. Think about that. By the time you are 70 years old, your kidneys may already be functioning at only 70% capacity compared to when you were 40. And that is in perfectly healthy people. People with no kidney disease, no kidney problems, no kidney symptoms whatsoever. This is simply what aging does. Now add high blood pressure on top of that. High blood pressure damages the tiny blood vessels inside your kidneys. These vessels are called glomeruli. They are the microscopic filtering units, the ones that clean your blood every single day when blood pressure stays elevated over time. These delicate structures become scarred. They become stiffened. They lose their ability to filter waste properly. And slowly, without you feeling a single thing, the kidneys begin to fail. This is exactly why doctors prescribe blood pressure medications to protect those filtering units, to reduce the pressure on those tiny vessels. And that is the right intention, absolutely the right intention. But here is where things get complicated. Some of these medications, when used in the wrong dose, or in the wrong combination, or without proper monitoring, can actually speed up kidney damage instead of preventing it, especially in adults between 65 and 75, whose kidneys are already working with much less reserve than they used to have. So let us talk about the 5 blood pressure medications that I want every senior in this age group to understand. The first medication is Lisinopril. Now, Lisinopril belongs to a class of drugs called ACE inhibitors. Other medications in the same class include enalapril, ramipril, and benazepril. ACE inhibitors are among the most commonly prescribed blood pressure medications in the entire world, and they do have real benefits. In people with diabetes, for example, they can actually help protect the kidneys. So I want to be fair here. These are not bad medications, but in older adults between 65 and 75, they carry a specific risk, a risk that most patients are never clearly told about. Here is how they work. ACE inhibitors block a hormone system inside your body, a system that controls how the blood vessels inside your kidneys constrict and relax. When you block this system, you reduce the pressure inside those tiny filtering units, and in many people that is a good thing. But in older adults who already have reduced kidney function, this pressure reduction can go too far. When the pressure inside those filtering units drops below a certain point, the kidneys cannot filter blood properly. Waste products begin to build up in the blood. A substance called creatinine starts to rise. And in serious cases, something called acute kidney injury can develop, sometimes very quickly. But there is a second risk with ACE inhibitors, and this one affects the heart as well. These medications cause the body to hold on to potassium. In a younger adult with healthy kidneys, that extra potassium is managed without any problem. But in older adults with reduced kidney function, potassium can build up to dangerous levels in the blood. This condition is called hyperkalemia, and it is serious because when potassium gets too high, it does not just affect the kidneys. It affects the heart. It can trigger dangerous heart rhythm abnormalities rhythms that can be fatal. So if you are taking Lisinopril or any ACE inhibitor right now, and you have never had your potassium level specifically checked, please call your doctor tomorrow and ask for that test. It is a simple blood test. It takes minutes, and it could save your life. The second medication is Losartan. Losartan belongs to a class of drugs called angiotensin receptor blockers. Other medications in this same class include Valsartan and Olmesartan. Now, angiotensin receptor blockers work in a very similar way to ACE inhibitors, and they carry almost identical risks. They are often prescribed when a patient cannot tolerate ACE inhibitors, because ACE inhibitors sometimes cause a persistent dry cough, which can be very uncomfortable. So the doctor switches to an angiotensin receptor blocker instead. That makes sense. But the risks to the kidneys are still there. They still reduce filtration pressure in the kidneys. They still cause potassium retention, and they still require regular and careful monitoring. What concerns me specifically about this class of medication in the 65 to 75 age group is that angiotensin receptor blockers are increasingly being prescribed together with diuretics, and that combination, when not carefully managed, can significantly increase the risk of kidney damage and dangerous changes in electrolyte levels. We will talk more about that shortly. The third medication is Amlodipine. Amlodipine belongs to a class of drugs called calcium channel blockers. And I want to say up front, Amlodipine is one of the most prescribed medications in the world. It works well for most people. It is generally well tolerated, and for many older adults, it is absolutely the right medication. But calcium channel blockers have a specific effect on kidney blood flow that older adults between 65 and 75 need to understand. Here's what happens. Calcium channel blockers dilate the arteries that bring blood into the kidney's filtering units. This lowers blood pressure overall, which is the goal. But these medications do not equally dilate the vessels that carry blood out of those filtering units. So more blood is going in than can comfortably come out. The pressure inside those filtering units actually increases in a younger adult with healthy kidney tissue. The body manages this without major consequences. But in adults between 65 and 75, whose kidney tissue is already less resilient, this elevated pressure over months and years can accelerate scarring inside the kidneys and lead to long-term damage. There is also another issue with amlodipine specifically. It commonly causes fluid retention in older adults. Swollen ankles, swollen feet, swollen legs. And when that happens, doctors often add a diuretic to the treatment plan, which brings us to the fourth medication. The fourth medication is hydrochlorothiazide. Hydrochlorothiazide is a thiazide diuretic. Another common one in this same class is chlorophyllidol. Now, diuretics work by making the kidneys excrete more sodium and water. This reduces blood volume, which lowers blood pressure. Simple logic, right? But in adults between 65 and 75, diuretics carry three serious risks that are not always properly communicated. The first risk is dehydration. Here is something most people do not know. As we get older, our sense of thirst becomes significantly weaker. Many seniors over 65 are mildly dehydrated most of the time without ever feeling particularly thirsty. Now add a diuretic to that picture, a medication that is actively pushing more fluid out of your body. And the blood flow to your kidneys can drop very significantly. When your kidneys do not receive enough blood flow, they begin to struggle, they begin to shut down. This is called pre-renal acute kidney injury, and it can develop surprisingly fast, sometimes within just a few days of starting a diuretic or increasing the dose. The second risk is low potassium. Thiazide diuretics cause the kidneys to excrete potassium, along with all that sodium and water. And low potassium is not something to take lightly. Low potassium causes muscle weakness, persistent fatigue, painful leg cramps at night, and most dangerously, abnormal heart rhythms. In seniors between 65 and 75 who are already taking other heart medications or who have any degree of heart failure, low potassium can be genuinely life-threatening. The third risk is elevated uric acid. Thiazide diuretics increase uric acid levels in the blood. This can trigger painful gout attacks in older adults who are already prone to high uric acid. And there is something else. Chronically elevated uric acid has itself been linked to accelerated kidney damage over time. So the medication causing the high uric acid is indirectly causing further kidney damage on top of everything else. Now we come to the fifth concern, and this one is the most dangerous of all. It is not a single medication. It is a combination. It is being prescribed both an ACE inhibitor and an angiotensin receptor blocker at the same time. Some older adults are on both of these simultaneously, often because they were prescribed by different specialists who were not fully communicating with each other. One doctor prescribed Lisinopril, another doctor prescribed Losartan, and nobody stopped to check if taking both together was safe. This combination was once believed to provide superior kidney protection, but a large clinical trial published in the New England Journal of Medicine found something very different. Combining these two classes of medication actually doubled the risk of acute kidney injury. It also significantly increased the risk of dangerously high potassium levels. Major cardiology and kidney medicine guidelines now specifically recommend against this combination if you are currently taking both an ACE inhibitor and an angiotensin receptor blocker at the same time. Please bring this up with your doctor. At your very next appointment, ask specifically whether this combination is right for your current kidney function. Take someone with you if you need to. Write the question down so you do not forget. This is important. Now, I need to say something very clearly, and I need you to really hear this. Do not stop taking your blood pressure medication. Not based on this video, not based on anything you read online, not without speaking to your doctor first. Uncontrolled high blood pressure is itself one of the most destructive forces acting on your kidneys. Stopping your medication without guidance could cause a stroke, a heart attack, or accelerated kidney failure, far faster than the medication risks I just described. The goal is not to stop your medication. The goal is to make sure you are on the right medication, at the right dose, with the right monitoring in place. And that brings me to something extremely important, something that I believe could be the single most valuable thing you take away from this video today, the monitoring that every person between 65 and 75 taking blood pressure medication absolutely must have. Your doctor should be checking your kidney function through a blood test, at least once every 6 months. If you are on any of the medications I mentioned today, this blood test checks your creatinine level. It checks your estimated glomerular filtration rate, which is the most accurate measure of how well your kidneys are currently filtering your blood. It checks your potassium level, your sodium level, and your blood urea nitrogen level. If you have been on blood pressure medication for years, and you cannot remember the last time your doctor checked these numbers, please call your doctor's office tomorrow morning and ask for this test. It is a simple blood draw. It is covered by Medicare and most insurance plans, and the information it gives you about the health of your kidneys is something no amount of guessing can replace. Now, I also want you to know the warning signs, the signs that your kidneys may already be under stress, because most kidney damage in older adults is silent until it is not. Watch for swelling in your ankles, your feet, or your legs, especially if that swelling has gotten worse recently. Watch for changes in how often you are urinating, more than usual or less than usual. Both can be significant. Watch for urine that looks foamy or frothy. Foamy urine can indicate that protein is leaking into the urine, and that is a classic early sign of kidney damage. Watch for fatigue that does not improve no matter how much you rest, a feeling of pressure or discomfort in your lower back, on either side of your spine, difficulty concentrating, or a brain fog that has gradually been getting worse, an unexplained nausea, or a loss of appetite that you cannot explain. Now, none of these symptoms alone confirms kidney damage, but if you are experiencing any combination of these, particularly while taking blood pressure medication, please bring them to your doctor without delay. Do not wait for your next scheduled appointment. Call and go in. Now, let me share 5 things you can do right now to actively protect your kidneys while you continue managing your blood pressure. The first thing is to stay hydrated consistently throughout the entire day. This is especially important if you are taking a diuretic. Aim for 6 to 8 glasses of water. Spread evenly throughout the day, not all at once. Spread throughout, and avoid going long periods without drinking anything, especially in hot weather or after any physical activity. The second thing is to reduce your sodium intake as much as you possibly can. High sodium intake directly raises blood pressure, and it increases the filtering demand on kidneys that are already under stress. Working toward a daily sodium intake below 1,500 milligrams is one of the most powerful things you can do for your kidney health. If you are not sure how to achieve that, ask your doctor for a referral to a registered dietitian. They can help you do this in a practical and sustainable way. The third thing is to eat foods that actively support your kidneys. Blueberries are exceptional for this. They contain powerful antioxidants that reduce stress on kidney cells. Red bell peppers are ideal for kidney health. They are low in potassium and phosphorus, and they are rich in vitamin C and B6. Garlic has been shown in research to reduce kidney inflammation. And it has natural blood pressure lowering properties as well. Cauliflower is high in folate and fiber and contains compounds that help your body process harmful substances before they can reach and damage the kidneys. And extra virgin olive oil reduces the systemic inflammation that drives kidney scarring over time. These are not miracle foods, but eaten consistently, they give your kidneys real support. The fourth thing is to be very careful with common pain relievers. There is a class of pain medications that many older adults take regularly without a second thought. These include ibuprofen, sold as Advil and Motrin, and naproxen, sold as Alev. These are available without a prescription, which makes people assume they are completely safe, but they are not safe for your kidneys, especially when taken alongside ACE inhibitors or angiotensin receptor blockers or diuretics. This three-drug combination has a name in kidney medicine. Doctors call it the triple whammy. An ACE inhibitor plus a diuretic plus one of these pain relievers can cause serious acute kidney injury very quickly. If you need pain relief, please speak to your doctor about safer alternatives. Acetaminophen, sold as Tylenol, is generally considered much safer for the kidneys when used at the right dose. The fifth thing is to ask your doctor for a full medication review. If you are seeing multiple specialists, a cardiologist, an endocrinologist, a rheumatologist, it is entirely possible that no single doctor has a complete picture of every medication you are taking and how those medications are interacting with each other. Ask your primary care physician to review all of your blood pressure medications alongside your most recent kidney function results and your electrolyte levels all together at the same time. This kind of coordinated review has been shown in research to significantly reduce harmful drug interactions in older adults. It is one of the most important conversations you can have with your doctor, and you have every right to ask for it. Let me bring everything together now. If you are between 65 and 75, and you take blood pressure medication, your kidneys are working in a more vulnerable state than they were 20 or 30 years ago. ACE inhibitors like Lisinopril, angiotensin receptor blockers like Losartan, calcium channel blockers like Amlodipine, thiazide diuretics like Hydrochlorothiazide, and dangerous combinations of these drugs all carry real and specific risks for kidney damage in your age group when not carefully monitored. The answer is not to fear your medication. The answer is to be informed about it, to ask the right questions, to insist on regular kidney function testing, to protect your kidneys through diet and hydration, to avoid pain relievers that stress the kidneys, and to make sure that every single doctor treating you has a complete and accurate picture of everything you are taking. Your kidneys filter around 200 liters of blood every single day. They work without rest, without complaint, and almost entirely without your awareness. The least we can do is pay attention to them before the damage becomes irreversible. I am Dr. Daniel Chen. If this video gave you information that you did not have before, please share it with someone between 65 and 75 who takes blood pressure medication. It could protect their kidneys before it is too late. Subscribe to this channel for weekly videos made specifically for older adults who want to stay informed, stay healthy, and stay in control of their own care. And leave a comment below. Tell me which of these medications you are currently taking. I read every single comment, and your experience may help someone else watching this video today. Take care of your kidneys, because once they are gone, nothing brings them back.